Thank you, Caoirleach. Minister Butler, I warmly welcome you to the Shannon this afternoon. I addressed the Minister for Health earlier on the COVID vaccination programme. I commented on the vaccination programme and the state of progress with it. I made fair comments about well-publicised flaws and delays in it, as well as talking about the state of the nation in lockdown. I was talking about the efforts of the Government and NPHET policy on the people of Ireland, on the vulnerable, those with disability, children missing education, people struggling financially, those in grief. Quite simply, I take a holistic view of the events of the past 13 months. I do not believe it is good public policy to take drastic action without a full evaluation of the cost of such action, including the devastating effect that it is having on the lives of people and their health. Some of my colleagues in Fianna Fáil and Fine Gael have accused me of personalising the debate. The irony and the hypocrisy, they are the ones who have viciously ganged up and attacked me repeatedly. Please point out what I have said personally, that it was an attack on the Minister for Health. Can I not say that I do not have confidence in his management of the crisis? The selective hearing of my government colleagues is remarkable at best, disingenuous and malicious at worst. Contrary to what they claim, I acknowledge the difficulty of the multiple aspects of his ministerial brief. I actually empathise with him, and I suggested bringing in a minister to deal specifically with COVID and vaccinations, allowing him to concentrate on mending the ailing healthcare system. Why are the Government trying to play the victim card in the political arena? Is the Oireachtas now not a safe place where one cannot criticise or debate or ask questions? The attitudes of my colleagues in this House is repugnant to the very fundamental principle of a parliamentary democracy, to freedom of expression itself. Some of the laws and policy decisions over the past 13 months were previously unimaginable. They are so grave, they are almost without precedent. Am I not entitled to criticise the performance of the Minister, or the Government, or their policy decisions, or the laws they pass, or the blind subservience to NPHET, or their faltering and incoherent response to the pandemic? They accuse me falsely of being a vaccine sceptic, a derogatory label designed to undermine me. They clearly need to go back to school and practice their comprehension. I asked valid questions about their approach of the Government and about the efficacy of the vaccine that has been developed in a matter of months. It is simply a fact that most vaccines take about 12 years to be developed, to be put through clinical trials, to be approved by regulators as safe and effective. 12 years, not 9 months. I read scientific journals like The Lancet and the BMJ, quoted on the RTE website, that pose similar questions about the data on the vaccines and to what extent they have reduced hospitalisations and deaths. I may not permit it to ask for information and clarification. I believe it is the Government that are the vaccine sceptics. They supported the suspension of 30,000 vaccinations using AstraZeneca on a mere whiff of an issue. 11 million people have been vaccinated in the UK without any clinical evidence of medical complications. That decision was not supported by the data or the science, like so many of the Government's decisions. Day after day, we hear one report or another about vaccine delays, targets being missed, while our nearest neighbour in the UK are going full steam ahead. Northern Ireland, with a population of 1.8 million, has administered over 100,000 more than we have south of the border. We have given one dose of vaccine to the population roughly the size of Cork City and County. Our Living with COVID plan, if such a thing exists, and our vaccination programme are rapidly descending into a farce. I am not a proponent of a blunt application of lockdown policies without adequate evidence for them being effective and beneficial. We've locked people up in hotels that have been likened to prisons. We have heard media reports about some people absconding from these hotel cells. Whatever about mandatory quarantine for international travellers, we cannot lock our people up any longer. They have endured enough. Minister, accelerating and vaccination rollout is of paramount importance. I propose giving the sole responsibility of this task to a new minister. Minister Donnelly could then concentrate on salvaging the wrecked health system. That is perhaps the only solution if we are serious about getting out of this never-ending rolling lockdown. I realise I am not going to make any friends by saying these things, but I am not here to make friends. I am here to try and improve people's lives and to goad the government into action.